Welcome to Cambridge Health Alliance Health as well. My name is Roberta Robinson. I'm Director of Marketing and Outreach for the Geriatric Division of the Cambridge Health Alliance, including the PACE program. Today we have Melissa Shirtcliff with us. Did I say it right?
You did.
I did. I said it right. And Melissa is from the Alzheimer's Association. So I think people are familiar with and thank you for being here. Welcome.
Thank you for having me.
My pleasure. So I think people have heard the term Alzheimer's. I think there's a lot of fear out there for people about the disease, and we hear so much about it. Now we hear that it's affecting people younger and younger, and so I think there's a lot of fear out there. I think maybe we could explain what Alzheimer's is. And that it's under the umbrella, maybe, of dementia. Do you feel comfortable doing that?
Absolutely, yes.
Okay.
So Alzheimer's is a progressive disease. Dementia is, we use that as an umbrella term. So it's the symptoms. And Alzheimer's is a specific disease under dementia. But one thing that's important is that Alzheimer's isn't a natural part of aging. It is a disease. It's not something that everybody gets.
And that is a very important point, because I think people think because they get old, and I know plenty of people in their 90s. My mother was one of them at 89, and her father, 3 months before he was 100, he passed, and they were crystal clear.
Yeah.
So it doesn't necessarily go with the age.
Right. Correct. Right.
I'm not exactly sure what it goes with, but
right. Age is a risk factor of Alzheimer's disease, but there's other risk factors that do go along with that. And there's other symptoms that go along with Alzheimer's disease besides just memory loss. It's, disruption of daily tasks. There are other symptoms that go along with
problem
Alzheimer's
solving.
disease.
They can no longer problem solve. They can't retrace steps.
Correct.
So where you and I might go in, for instance, every night I walk in my house and there's a back of a couch facing me. My keys go on that couch. If the next morning I go to reach for my keys and my keys aren't there, I have to say, what did I wear yesterday? Because it's probably in the pocket of whatever it was. But I have to then recall what I wore, which isn't always the easiest thing either, and then go to that pocket. So that is retracing the step. But they've lost, people with the disease of Alzheimer's can no longer do that. They can't process anymore.
Correct.
And we know the disease, when people they might repeat a question over and over, or tell you the same story over and over again.
Or forget words, can't quite recall the correct words.
But they're very clever. I just want to tell, they're very clever because they might say, for instance, if they can't think of the word key, they might say, the thing that goes in the door?
Yeah.
Right? And then we say, you mean key? And they say, right.
Right. There's little tricks that they can learn and ways to sort of help with that aphasia and loss of recalling words. So, yeah.
Not to say that every time we forget a word, we have the disease. That's not true.
Right. There's a baseline.
Yeah.
And people forget things all the time. We're sometimes overscheduled, busy. And so sometimes you may forget things. You may misplace your keys. You may misplace things. But that is, if you have that baseline, there's a difference between everyday, misplacing items versus it being Alzheimer's disease.
So I'm still calling and getting away with circuit overload.
Yes.
The computer can only hold so much.
Right.
It's still working for me. Right? So, and the disease is very prevalent. Just today I was reading that there are 5 million Americans that have the disease of Alzheimer's now. But in 2050, this blew me away. In 2050, they are expecting that 16 million people will have the disease of Alzheimer's. That is mind-boggling.
Yes.
We need to find a cure.
We do need to find a cure. Yes, absolutely. Yes. Unfortunately, the numbers do keep increasing, and we're not sure why that is, if it's that people are living longer, or what exactly the reason behind that is, but they are expecting that number to increase over the years, unfortunately.
So tell us, the Alzheimer's Association, I think maybe some people know it exists, maybe not everyone does know it exists, but they have a wealth of, they're located in Waltham, right?
Correct. Yes.
On Waverly Oaks.
Yes. Waverly Oaks Road.
Hmm?
Waverly Oaks Road in Waltham, yes.
And they have a wealth of information. So can you tell us some of the things that they have over there to help and aid people and caregivers?
Yes, absolutely. So the Alzheimer's Association is a national nonprofit organization that's really focused on providing care and support to families that are impacted by Alzheimer's disease, also about funding research and raising awareness of the disease. So some of the programs and services that we offer to families are things like our 24/7 helpline, where we have a hotline where you can call any time of day for whatever the reason may be. Maybe you're noticing changes in a loved one. Maybe you have a loved one who was recently diagnosed, or maybe you're currently caregiving for somebody and just having a really tough day. For whatever the reason is, you can call us. We have trained staff, clinicians that are available anytime that you need us. So that's one of the best resources that the Alzheimer's Association offers to families, is that 24/7 helpline.
And they tell about the resources and give a little guidance when people are lost and immersed in caregiving. It's, it really sort of takes over your life.
Yes, absolutely. Yeah. So it's sort of that beacon for caregivers to reach out, that somebody is there with information, resources, or even just an ear to listen to them. So that's one of the resources that we offer. We also have care consultations where families can sit down with licensed social workers to come up with a care plan, talk about sort of the next steps, how to go through this disease, what to kind of get in order, resources, information, all of that will be done in a care consultation with a social worker, and they come up with this care plan for families that's really individualized for those.
It's kind of like
families.
A roadmap.
Exactly, exactly. And we also have education programs as well. So you mentioned about caregiving. There's programs that really focus on things like legal issues, financial issues, educational programs around things that you may not have thought about yet. So helping to educate the caregivers as well as those living with the disease. We have some programs around that as well. And then support groups. Support groups are really important. So we have support groups for families, we have support groups for caregivers, and also support groups for those who are living with the disease.
Now, they used to have some not joint, but you could go at the same time in some places. So if a caregiver is afraid or cannot leave the person or the patient with Alzheimer's alone, or doesn't want to for any reason, there are some places where they have the support groups, one for the patient and then one for the caregiver. And also, while I'm thinking of it, the Memory Cafe, which is relatively new in the last few years, and that is a fun thing. It's a light and lively, no doctor appointments, no heaviness, just to go with your loved one and enjoy whatever. They have music, they have painting, they have lots of dancing, I think.
Yeah, they're all different. Some are structured, some are not. Some have different activities. So those are great things to take advantage of. And actually, that also reminds me of the Alzheimer's Association has what we call Alz Meetups, where it's an opportunity for those who are living with early stage Alzheimer's to, with their care partner, go to different events. So it might be coffee, it might be a nature walk, it might be going to visit a museum. So that's another great program.
So it would all be patients and
their caregivers. Yes.
Oh, and their caregivers go to that. Oh.
Yep, with their care partner. And it's usually for people that are in the early stages. But we do know that engagement is is very important for those living with Alzheimer's. So this is a program to help keep them engaged, and we have a variety of different types of events that they can go to based on their interests.
Right. That's nice. So that there's something for everybody.
Yes.
Right?
Absolutely.
Yeah. And there are a lot of them around in a lot of different cities. I know Cambridge has one, Belmont has one, Waltham has one.
Mhm.
And trying to go around the area, but I don't know where else they might be.
Yeah, they're in almost every community, it seems.
That's wonderful.
So, yeah,
because it is relatively new.
Mm-hmm.
Yeah.
Good. Absolutely, yes.
What else does the association have for us?
So the association, in addition to the programs and services that we offer, we also have community programs. So raising awareness, educating the general public about the disease. So we'll be out in the community providing educational programs. Some of the programs are Know the 10 Warning Signs of Alzheimer's disease. Another one is Healthy Living for a Healthy Brain. So sort of providing some of those tips about how to live healthy, eat healthy.
That's for all of us,
brain.
and not only that. If we start early, maybe we can prevent some of these things, right? That's my goal.
Right.
And exercise, because we have to stimulate the brain, get the oxygen, the blood to the brain, feed the brain, keep the brain stimulated, stay plugged in to things, so that engagement for all ages, right? So important.
Yes, yeah. I mean, and there's research that shows what's good for the heart is good for the brain. So that healthy living lifestyle certainly helps. Right.
And I wanted to say that if I could just say that as part of community education, there are Alzheimer partnerships. Now, Massachusetts is the only state in the country to have these partnerships, I believe. And we have them here. And I happen to be co-chair to the Metro North Partnership. So we put on events in the Cambridge area, in the Burlington area. We're going to be putting a legislative breakfast on in the Burlington area in October. So that's also, we are out there doing, and it's usually made up of groups of providers from different organizations that serve the elder population. Oh, they don't call us elder anymore. They call us older adults. I can't train myself on that one yet. I'm working on it. But so we're out there. The partnerships are out there as well, not only the association out there. So there are lots of different ways to educate people of the disease and to let them know. And even if you don't have the disease or you're not affected by the disease in your family, maybe you know someone who might be, and then you could refer the resource to them.
Absolutely. And one thing that I do want to mention is that all of our programs and services and resources are available at no cost to families.
That's an important one.
We know the impact that Alzheimer's has on families, and we want to be there to support and not add any additional burden, financial or otherwise. So all the programs and services are available at no cost. And a lot of information on our website as well, which is alz.org. On that website, there's information about the disease. You can also look up the latest, what programs are in your area, what support groups are in your area, and the latest information about research as well.
Right, and the 10 warning signs, which might be one of the first things you want to check out.
Yeah, absolutely.
So, and now we have a big event that we're preparing for.
We do, yes.
And this is your baby.
Yes. Yes, so the Greater Boston Walk to End Alzheimer's is our fundraising event that's coming up. The Walk to End Alzheimer's is nationwide. It happens across the country. We have over 600 walks that take place, and the Greater Boston Walk is actually one of the largest walks and is one of the top fundraisers for the Alzheimer's Association in general.
And that money goes where? Because I know that would be an important point for people.
So the money that's raised goes to Alzheimer's care, support, and research. And the walk is our largest fundraising and public awareness event for those causes, Alzheimer's care, support, and research. So the money is going directly back to families, to research, and just helping us to support those families.
To families maybe for respite, if they need a respite, or for
not
some
necessarily
services,
respite, but more the programs and services.
I see.
Yes, we don't unfortunately offer respite care, not at this point, but more the programs and services, those educational programs, the support groups, the 24/7, all of that is funded by donors and by our fundraising events like the Walk to End Alzheimer's.
So the Greater Boston Walk happens right here
in Cambridge.
In Cambridge at DCR North Point, is it called?
Correct, North Point Park.
Right across from the Museum of Science.
Right, exactly, yes. We have free parking at Cambridge Side or...
Cambridge Side Galleria.
Yeah.
It's old hat to you.
I was going to say. Yep. And also it's accessible, the public transportation, the Green Line at either Science Park or Leechmere. So it's easy to get to, which is nice. And the walk is just a great day to come out to support the cause. It's a day of hope. We are there to come together as a community to, raise awareness, raise funds, and hope for a cure.
Right, and I know there are a number of vendors that are around the park, and even if people cannot walk, just basking in the energy of the high energy of the walk is something. So even if you're not able to walk, and there are two different, I think there's a 3 mile and a 5 mile, is there?
1.5 and 3.5.
Oh, 1.5 and 3.5.
Yes, so it's certainly something that really anybody can participate in. We try to make it so that everybody can participate. So if you aren't able to do the 3.5 mile, the 1.5 mile is certainly something that most people can accomplish, which is nice.
And it is a beautiful walk. I am actually team captain again for I think maybe the 5th year, and it is a beautiful walk. We walk down by the Constitution and around, so it's lovely, and Zachem Bridge, and it's interesting because I had, until I did this walk, I never saw the Zachem Bridge from that angle. It's a different, a whole different perception of the bridge, right? But that's what life is all about, getting different perceptions along the way. But it is a beautiful walk. There is even a playground there, so even people come and bring children and have the children play in the playground. Yeah. So it's a day for everybody.
It is, yes, absolutely. We have a children's area. We have the playground. We do have pets that come. Well-behaved pets on leashes are allowed. We have a doggy area with doggy bowls and water and bandanas and sometimes doggy treats. So really, we want everybody to come out that day and support the cause and join us for a great day.
And we are taking donations for that walk?
We are, yes.
All year round.
All year, yes. Yes, so the goal for the Greater Boston Walk is to raise $1.5 million. So it's a big goal. We raised $1.4 million last year, so we're trying to raise a little bit more because we know every dollar that's raised helps to further the Alzheimer's Association's mission. So people that participate in the walk have the opportunity to fundraise, so they can solicit their friends and family to ask for donations.
I'll be sending my emails out.
And what we've found as well is that most people have a connection to this disease, unfortunately. And so by reaching out to friends and family and asking them for their support, most people are usually willing to make a donation, a contribution, because they have that personal connection. And it's a way for them to support a cause that they have a connection to and feel passionate about and want to help out. So,
and I always say there's no donation that's too small or too big.
That's right. That's right.
I have to add that in there. But I will say, this is probably a good point, since you're mentioning the connection, that, never before did I have a connection to this disease, but my brother did develop the disease, and my brother passed this week. So I definitely have a connection to the disease, and any money that I might raise for this walk will certainly not benefit my brother, but will benefit future generations and other people that hopefully, we have to find a cure for this.
Mm-hmm. Absolutely, yes. And one thing that we do as part of the walk is we have a remembrance ceremony. It's a beautiful ceremony. It's a beautiful piece of the event day where people show their connection to the cause by choosing a Promise Garden flower. So we have different flowers with different colors that represent their connection. So we have colors, purple is for those who have lost somebody to the disease, blue flowers are those who are living with Alzheimer's, yellow are caregivers, and then orange is that they're an advocate and a supporter of the cause.
Something for everybody.
Exactly. And one new addition that we've had recently is the white flower. And that is for our first survivor. And unfortunately, we don't have a survivor yet, but it is the symbolism of hope and to one day have that survivor. And we're hoping that we have many white flowers in years to come.
Right. So we have one on display right now.
Correct.
Right.
Well,
that's a good goal to aim for. I think we must have hope. Without hope, we go nowhere.
Right.
We must have hope to, and I'm wearing my white today.
That's right.
Not planned, but it's a disease that, in my experience, robs not only the patient, but the families as well. So it definitely is a sad one.
Right. This disease is
not
really
that
tough.
There's any happy disease.
Right, right. But it is very tough on families. You mentioned the 5 million Americans who are living with Alzheimer's disease, and with that number, there's also 16 million caregivers who are caring for somebody with the disease. And it's staggering to see those numbers, and that number will also increase as more people develop the disease.
Right. It's just coming to my mind maybe to mention that, if people feeling forgetful, it's a good thing to talk to your doctor and run it by your doctor, and to actually, if it goes and affects some of the areas that we spoke about, like any activities of daily living or directions, that's a big one. When people all of a sudden are in familiar area and cannot get back to where they want to go, home or whatever. So those are some big signs. And I think that a neuropsych test is actually the evaluating test, which would give someone a diagnosis or not. But I would encourage people to talk to their doctor, not to hide with it, because there are medicines out there today that can, although there's no cure, but it can slow the progression of the disease and may give people more time to be cognitively aware and still participate in life.
Absolutely.
So a lot of people I know hide out. They just pull the covers over. They don't want to know, but you need to know.
Right. Early diagnosis is important. It helps with the engagement piece. It helps to get the medication that can sometimes help with symptoms, and also just to get some things in order, like the financial issues and the legal issues, and really getting ahead of that all.
Right. Right. So, often we will offer, at health fairs, we'll offer memory screenings. And I do think that people are braver now than they used to be. I used to have people run away from me and say, no. They didn't want to find out, but we need to find out. Now I think if it's not out, they're working on it, a blood test that would be able to tell if a person, and they can tell even, I think, with a gene. I think this is relatively new. Yeah. Whether you're predisposed to the disease or not.
Right. If you have the genetic, there's one type of genetic gene. It's not as common, but yes, you could have a genetic testing done for that as well.
Whether we know we're having a disease or predisposed to a disease, or whether we don't, every day we should live life to the fullest. Every day. Because we never know what the next moment brings. Any one of us. We never know. And so we need to make the most of the time on this earth plane. And live it to the fullest.
Yeah, absolutely.
Is there anything else at the association? Oh, maybe the phone number.
Yes. So the phone number for the helpline, our 24/7 helpline, is 800-272-3900. So, and then also our website, again, I'll give that. It's alz.org. And through the hotline, the helpline, and the website, you can certainly reach out with questions, concerns, or just somebody to talk to.
Right. And that helps too, because sometimes you feel that you're the only one going through this, right? Or you feel that there might be a question that might be silly to ask. There is no silly question. You've asked the questions, or if you haven't asked them, someone else has asked before you. So knowledge is power. The more we know, the more we can, and even if we get a diagnosis, all the more reason then to live life to the fullest. And it doesn't mean life is over. It means that, okay, you're going to do everything in your power so that it doesn't progress. Exercise, healthy eating, all of the things that we all should be doing anyway.
Right.
For any disease, any doctor that sits in this chair here and we talk about it, we always go back to diet, exercise, and socialization. That's it. Yeah. We have to plug in.
Yes. And there's also clinical trials as well. So that's an important piece, is that there's lots of research going on right now. And one of the biggest barriers of the research is not enough participants to get involved, to have those studies. So clinical trials are a great way to help out, whether you've been diagnosed or not. There's clinical trials for all different levels. So,
and I think they set up a booth at the walk.
They do, right? Correct. They do.
Yeah.
Yes.
So come and join us at the walk. This walk goes on. We didn't give the date.
So the date is September 22nd. It's usually the fourth Sunday in September. And as Roberta mentioned, it's at DCR North Point Park in Cambridge, and it'll be a great day. It starts in the morning. It's Red Walker check-in starts at 8:30, and our opening ceremonies begin at 10 a.m.
Great. Well, thank you so much for coming on board. I'm hoping that you got a lot of information, a lot of useful information, and a lot of hopeful information as well.
Thank you.
Melissa.
Yeah, thank you.